Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont dans l'ordre suivant, sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre Blaine Higgs. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. Depuis notre dernière séance d'information sur la pandémie de COVID-19 mercredi dernier, 13 citoyens du Nouveau-Brunswick sont morts des répercussions de ce virus. Le plus récent décès est une personne âgée de 80 à 89 ans de la zone 4, soit la région d'Edmundston. Nous sommes tous personnellement affaiblis par chacun de ces décès. Je vous demande de vous joindre à moi aujourd'hui pour exprimer nos plus sincères condoléances aux familles endeuillées en ces temps difficiles. Since our last public briefing on the COVID-19 pandemic, 13 New Brunswickers have died due to the effects of this virus. The most recent death is an individual aged 80 to 89 who resided in Zone 4, which is the Edmundston area. Each of these deaths diminishes all of us, and I ask that you join with me today in offering heartfelt condolences to these bereaved families in their time of grief. We have seen an unprecedented number of deaths, hospitalizations, and ICU admissions over the last month, more than at any time since the pandemic began. New Brunswick has also seen record numbers of new cases and active cases. We had expected more cases after the mandatory order was lifted in July. And again, we made reference to that in many of the announcements and media interviews. Government has already taken steps to slow the spread of COVID-19, including the reinstatement of the state of emergency and mandatory order. But with our healthcare system under significant strain and Thanksgiving holiday approaching, more actions are needed to protect the health and safety of New Brunswickers. Le Premier ministre Higgs discutera plus en détail des mesures coupe-circuit recommandées par Santé publique et approuvées aujourd'hui par le cabinet et le cabinet COVID-19. Tout d'abord, je tiens à expliquer pourquoi ces mesures sont nécessaires et à quel point il est absolument crucial que tous les citoyens du Nouveau-Brunswick respectent rigoureusement ces règles et suivent au pied de la lettre les recommandations et les consignes de santé publique. Aujourd'hui, Santé publique confirme qu'il y a 90 nouveaux cas de COVID-19 au Nouveau-Brunswick. La liste complète des cas se trouve dans notre communiqué de presse et sur le site web de GNB. Il y a présentement 782 cas actifs de COVID-19 dans la province. Comme c'est le cas depuis plusieurs semaines, la majorité de ces cas se trouvent dans la partie supérieure de la vallée de la rivière Saint-Jean, dans la région d'Edmundston, ainsi que dans la grande région de Moncton. Des mesures coupe-circuit seront mises en application dans ces régions afin d'empêcher le virus de s'ancrer davantage dans ces collectivités. Ces mesures s'imposent en fonction de notre situation et du risque posé par la COVID-19. Today, Public Health has reported 90 new COVID-19 infections in New Brunswick, and the full list will be in our press release and on the GNB website. There are now 782 active cases across the province. As has been the case for the last several weeks, the bulk of these cases are concentrated in the Upper St. John River Valley, the Madawaska area, and in the Moncton and surrounding communities. Those are the hot zones where the numbers of infections, hospitalizations, and deaths have been the greatest. These areas are being targeted with circuit breaker measures designed to keep the virus from becoming even more entrenched in these communities. These measures are proportional to our situation and the risk posed by COVID-19. And as I have said before, we cannot lock down everyone everywhere until this virus has been eradicated. We all need to go to work, to attend school, to see friends and family, but we have to do these things as safely as we can. The recent surge in cases has created additional demand for COVID-19 testing. And I'm pleased to report that the backlog we saw last week has been eliminated, and we are now confident that we can provide results for priority testing within 24 to 48 hours. Testing for non-priority purposes, such as out-of-province travel, would continue to take longer as we address the immediate issue of slowing the spread of the virus and reducing hospitalizations. En date d'aujourd'hui, il y a 50 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 23 aux soins intensifs. La grande majorité des personnes hospitalisées, soit 82% d'entre elles, ne sont pas vaccinées. Des personnes âgées et fragiles sont présentement hospitalisées en raison du virus, mais il y a aussi des personnes plus jeunes et autrement en bonne santé. As of today, there are 50 New Brunswickers in hospital due to COVID-19. Of these, 23 are in intensive care. The great majority, 82% of these hospital patients have not been vaccinated. The elderly and even those who have been vaccinated are at greater risk due to underlying health conditions. This is why we are providing booster shots to nursing home residents who had early received 2 doses of a COVID-19 vaccine. This program will begin this week, starting in the areas with the highest case numbers. This additional protection will help reduce the number of elderly patients in hospital due to COVID-19. Everyone now in hospital with COVID-19, whether old or young, are fighting for their lives, and our doctors, nurses, and other health professionals are doing all they can to help them win that fight. The growing caseload of COVID-19 patients is straining our system, but we have been managing. The regional health authorities have been working together to try to manage this, but it is really at the point where things are extremely, extremely stretched. And if we don't arrest the current spread of the virus, we will be facing more issues in our health system and the people it cares for. If the spread of the virus were to accelerate unchecked, we would have more than 100 New Brunswickers in hospital at one time with COVID-19, and we don't want that to happen here. I am convinced we can stop this from happening, but only if every New Brunswicker who is eligible gets the full dose of a COVID-19 vaccine, 2 doses. Every person who gets the vaccine reduces the overall risk of hospitalization and deaths from COVID-19. And I know there are some New Brunswickers who will not be getting vaccinated for various reasons, and I understand that this is a minority in our province and will not likely be swayed by arguments that I make or evidence that I present, nor will they necessarily be convinced by pleading of friends of family who care about them. I still hope that everyone who can do so will choose to get vaccinated. Please talk to your pharmacist, your family physician, your nurse practitioner, or healthcare worker. But if you choose to remain unvaccinated, this is my advice. Please protect yourself. Votre santé et votre vie sont en danger en raison de la COVID-19, soit 16 fois plus qu'une personne entièrement vaccinée. Les personnes qui choisissent de ne pas se faire vacciner doivent suivre toutes les consignes de santé publique, porter un masque, se maintenir à une distance sécuritaire des autres et limiter leurs contacts au strict minimum. Vous devez éviter les grands rassemblements et demeurer à la maison si vous ne vous sentez pas bien. Those who choose to remain unvaccinated must follow all the public health measures, wearing a mask, observing physical distancing, limiting their close contacts to the absolute minimum, and you must avoid large gatherings, and you must stay at home when you feel unwell. These are actions that will protect those around you. It will protect all the people in the province, really. Your actions do have an impact. If you are not vaccinated, obviously the purpose of the vaccines is to protect your own health, but it's also to protect others. And so if you won't do this at least for yourself, then please do it for others. And we really, again, have to work together in order to stop the spread, in order to decrease the hospitalization numbers. It's really imperative right now. And for those healthcare workers that are working tirelessly right now, public health workers, et cetera, if you happen to know any of them personally, send them a text message, offer them your support and encouragement, drop off some food, et cetera. It is a really tough time right now for a lot of people. And again, we've gotten this far by working together, so let's keep on doing that.
Good afternoon. Bonjour. On behalf of all New Brunswickers, I extend sincere condolences to the family and friends of the individual who passed away because of COVID-19. Since last Tuesday, we have lost at least one New Brunswicker, if not more, every day to this virus. Our thoughts and prayers are with all of those who are mourning the loss of loved ones. As Dr. Russell has explained, we are in a serious situation in our province. We have 50 people in hospital, 23 in an intensive care unit. Of those in hospital, 7 are vaccinated, 2 have 1 dose of COVID-19 vaccine, and 41 are unvaccinated. Because of the number of people currently in hospital due to this virus, other services are being impacted. Certaines surgeries ont été annulées. Le personnel a été déplacé à des services plus prioritaires, réduisant ainsi des services. Il est nécessaire de prendre des mesures pour protéger notre système de soins de santé. That is why this morning at COVID Cabinet, all opposition leaders and Cabinet got together to discuss the recommendations of public health. I want to thank Roger Melanson, David Coon, and Chris Austin for their dedication to the best interests of all New Brunswickers as we move forward in dealing with this 4th wave of COVID-19, and we do so together. One of the initiatives agreed upon is that we will be implementing a mandatory vaccination requirement for parts 1, 2, 3, and 4 of the provincial government, as well as those for those working in long-term care and early childhood sectors. The only employees this will not apply to are those with valid medical exemptions. The deadline for people to be fully vaccinated is November 19th, 6 weeks from Friday. This will allow for sufficient time for everyone who has not yet done so to schedule and receive 2 doses of the COVID-19 vaccine. In the interim, individuals who are not fully vaccinated who become contacts of a positive case and need to isolate will be on leave without pay. If you choose not to get fully vaccinated before the deadline, you will be on leave without pay. Early learning and childcare facilities who do not ensure that their staff are fully vaccinated by November 19th face the possibility of losing their license. We are also taking steps to ensure as many students as possible can continue to go to school safely. This is essential for the mental health and well-being of children in our province. To further support our healthy and safety school plans, we will be rolling out a rapid testing program to help ease pressures on the public health system, improve response time, and get students back into the classroom more quickly. Beginning October 12th, unvaccinated students who are deemed to a close contact of a confirmed case will be provided with a supply of rapid tests along with instructions. Dès que l'école est informée d'un cas confirmé, les parents ou les tuteurs devront récupérer les kits de tests le jour suivant. Les élèves non vaccinés devront s'y isoler pendant au moins 24 heures, période pendant laquelle ils auront à subir l'heure du premier test de dépistage rapide. Unless otherwise advised by public health, students will be able to return Unless otherwise advised by public health, students will be able to return to school once they have recorded 2 negative tests and if they have no symptoms. To support these plans, vaccinated students will return to school as long as they have no symptoms. This aligns with current public health guidance on self-isolation requirements. Public health will notify students and staff who must stay home and get a PCR test. Les élèves vaccinés ou celles et ceux qui participent à un test de dépistage rapide qui ne présente aucun symptôme peuvent continuer à participer normalement aux activités parascolaires. Nous savons qu'il y aura encore des cas dans les écoles. Cependant, ces mesures vont aider à réduire les interruptions pendant que nous continuons à apprendre à vivre avec le COVID-19. Further, on the advice of public health, we will be implementing a 14-day circuit breaker for communities identified as being at the highest risk. The areas that will be impacted are Zone 1, the Moncton region, as far north as Saint-Anne-de-Kent, Zone 3, the Upper River Valley, north of Deerville, and all of Zone 4, the Edmundston region. More details will be available online at www.gnb.ca/coronavirus. As part of this circuit breaker, people must limit their contacts to their single household, which includes individuals living together, caregivers for any member of the household, and any parent, child, sibling, grandparent, or grandchild living outside the household who requires support. This means that indoor and outdoor gatherings are not permitted beyond your single household, except in public places where proof of vaccination is required. Travel to and from circuit breaker areas is prohibited unless travel is required for work, health services, child custody, child care, or post-secondary education. All schools will remain open, but school sports and extracurricular activities will be paused for those 12 and under. No spectators will be permitted for any school sports or extracurricular activities within the circuit breaker areas. Businesses, entertainment centers, and events can remain open and continue to admit those showing proof of vaccination and a government-issued ID, as well as children under 12 accompanied by a fully vaccinated adult. Les personnes peuvent s'y rendre en toute sécurité, car ce sont des mesures contrôlées. Le statut vaccinal y est vérifié et enregistré, ce qui rend plus facile la recherche de contrats si cela devient nécessaire. This circuit breaker will come into effect on Friday, October 8th at 6 p.m. and is projected to last for a minimum of 14 days, depending on achieving the necessary results. This step is required to protect our healthcare system and is aimed at achieving a reduction in hospitalizations. Traditionally, Thanksgiving weekend is a time that people gather with family and friends. Social gathering of unvaccinated New Brunswickers is driving our current situation. That is why we are requiring all New Brunswickers to limit contacts to single household close-town contacts for both private indoor and outdoor gatherings, beginning on Friday at 6 p.m. through until Monday at 11:59 p.m. This includes home gatherings both inside and outside, as well as playgrounds, skate parks, and other places people gather. Individuals showing proof of vaccination and a government-issued ID, as well as children under 12, accompanied by a fully vaccinated adult, can continue to go to businesses and events during this period. That is because these businesses are controlled environments where everyone is checked and confirmed to be fully vaccinated. The area of greatest concern right now would be casual in-home gatherings. I appreciate this is a lot to take in, but it is imperative that we now take decisive action if we're going to get this fourth wave under control as quickly as possible. Nous allons continuer à travailler avec la santé publique pour relever la situation dans toutes les zones de notre province. Cela va nous aider à décider si d'autres mesures doivent s'ajouter ou si nous pouvons commencer à lever les restrictions. We have simply lost too many New Brunswickers to this virus. Our healthcare system is feeling the strain, and too many eligible New Brunswickers are still choosing not to get fully vaccinated. In particular, New Brunswickers who are under 40 still need to get vaccinated. This is especially concerning in zones 3, 4, and 5, where the percentage vaccinated in this age group dips as low as 57%. While younger people don't drive hospitalizations, they can still get sick and spread COVID-19. I recognize that what we're asking is certainly not easy, and it will impact individuals and families across our province. We are doing so with the goal of protecting our healthcare system and ensuring services are there for all when you need them most. This is certainly not an announcement that I wanted to make. I have great difficulty when those individuals that are doing their part to help fight this virus, and we have to impact them in a way that affects their social life, their family, and their friends. Unfortunately, it is necessary because our vaccination levels have not reached the necessary 90%. We are seeing hospitalization rise, and as we reported, primarily due to unvaccinated admissions. And this will start to impact in a greater way elective surgeries or our ability to provide the health care when needed. Left unchecked, we also could factor into further restrictions. But I am hoping this 2-week circuit breaker in the areas most impacted and the measures we're taking throughout government to cause vaccinations to be mandatory, or there will be consequences, and there will be financial consequences. We must act. We cannot delay any longer. I ask for your patience, your diligence, and your perseverance as we get this under control and we get back to having a normal life here in New Brunswick. I appreciate this weekend's going to be tough for my family. It's going to be tough for many families because Thanksgiving is a time when we all give appreciation for the blessings we share in this wonderful province. We will get them back. We just have to delay it a little longer. Thank you very much for your cooperation. Let's continue to work together to make this success.
Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux périodes de questions avec les membres des médias. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. We'll now proceed to question period with members of the media. Each reporter will have one question, and you have the right to pose your question in the official language of your choice. Jennifer Baza, CTV.
Good afternoon. My question is either for the Premier or Dr. Russell. Previously, Dr. Dow said that we would need 90% of the population to be fully vaccinated until we can reach optimal community protection. So I know we just introduced all these new restrictions now to kind of help things get under control, but do you foresee restrictions remaining in place until that percentage is reached?
I can answer. Right now, our target is really to reduce hospitalizations and whatever the measures are that we need to put in place, which we are today. That's what we're going to focus on, and we know that it's going to probably take about 2 to 3 weeks to see the effects of what's happening now. During that time, it is very important for us to continue to increase the percentage of the population that's vaccinated with 2 doses. And I think that we have also said throughout that the layered approach will still be necessary for the most part. So again, we're using all the tools in our toolbox right now, and we will continue to encourage those all of those measures to be utilized.
Well, I can add to that. I know it's going to be, we're at 81% roughly at this point, but 89.7 or so percent in terms of seeing the first vaccine. So one would have to say that if you've gotten one, you're apt to take the second one. And so achieving it, although difficult, it would seem that it is indeed possible. So I would just encourage those that have gotten their first dose to get their second, and we'll be there. We'll be at the 90%. Unfortunately, there appears to be 10% in just about any walk of life that are choosing not to get vaccinated, and they will continue to have a negative impact on our ability to corral this virus and have life as normal with vaccinations. But that's what we have in many diseases of the past. We've come to live with vaccines that have basically eradicated a particular illness from the past. So let's do it again with a COVID vaccine, and right now, 90% is our target.
Thank you both. Travis Fortnum, Global TV.
Hey there. So we are hearing from some of the opposition leaders about concerns over a lack of transparency between the government and the people of New Brunswick as this wave bears down on us. I'm wondering, maybe if I could hear from both of you, what the justification would be that it's taken us a week to hear from you when you say, as you say, we've lost 13 New Brunswickers.
Well, I think, and I'll start with that, and Dr. Russell can carry. Our target has always been focused from the very beginning on hospitalizations. And what unfortunately, when with increase in hospitalizations, and certainly people that are impacted by COVID-19 and those on ICU and those sick outside with COVID, the possibility of death has risen, and we've seen that in the numbers. Unfortunately, you know, it has risen again because we haven't been able to achieve the necessary vaccination levels. But hospitalizations at the point where it starts to impact other activities in terms of elective surgeries, in terms of critical surgeries, we're you know, I commend the staff in the hospitals and the professionals that are managing our facilities, and in some cases it's much more extreme than others, like the Edmundston area. But the networks are working together, and we've had discussions very recently with medical professionals and how to manage through and transfer patients as needed. But reaching 50 was kind of a threshold to say, you know, it's continued to rise not only in hospitalizations, but in terms of the number of deaths that have averaged out, as I said, one a day over the past week or more, if not more. You know, that has to stop. And so we have to corral this virus, and we have to do what's necessary to protect the ones that are vaccinated but vulnerable because they have other mitigating facts, and the ones that choose not to get vaccinated but continue to spread it to those, and then it just keeps snowballing. So it's been driven by hospitalizations and at the point in time when the impact on the average citizen who just is going to the hospital for not COVID reasons and having delays in what they need for their health care.
Sorry, I don't think that I was clear in what I was asking. I was asking why you, Mr. Premier, and Dr. Russell haven't had a public briefing in the past week, even though we've had probably the worst week we've had yet in this pandemic.
We were here last on, what day was it?
Wednesday.
Yeah, Wednesday. And there was nothing further to report as far as what changes were going to be made and what level of hospitalizations were required. So, and I think last Wednesday, you know, we had a lot of discussion. Okay, what have we added to this, and over and above what our press release is? So today I would say that we came with news of change, and we're also at a point where we're.
Le temps alloué à l'enregistrement est maintenant écoulé.
That is not me.
Pour continuer d'enregistrer, faites le 5. Pour revoir le contenu de votre message, faites le 2.
Okay.
Pour plus de renseignements, faites l'étoile.
Everybody, please place your microphones on mute.
Well, only as I think we're here today with, after you know, an extensive conversation throughout the entire weekend with health professionals, with public health, with outside agencies and societies to determine what are the next moves and what's the level of hospitalization, what's the criticality in different zones around the province. So when we come to the press release, it's coming with information more than you can particularly read on a press release, and that's why we're here today. And we'll continue to come when it's necessary to deliver a message that is of an urgent nature or of a changing nature.
Thank you. Frédéric Camarano, Radio-Canada.
Bonjour, ma question s'adresse à la médecin hygiéniste en chef ou au premier ministre. Donc, il semble assez clair que les personnes vaccinées peuvent tout de même transmettre la COVID-19. Donc, à ce moment-là, je me demande pourquoi est-ce qu'on permet aux entreprises non essentielles de demeurer ouvertes?
Essentiel ou non essentiel?
Non essentielles, désolé.
Parce que la plupart des endroits comme ça, il faut démontrer votre preuve de vaccination avec 2 doses. Alors, c'est un environ qui offre la protection au niveau des doses de vaccin. Oui, c'est vrai qu'on peut transmettre, on peut l'attraper, mais le risque de l'attraper est bien plus bas avec les 2 doses de vaccin, et le risque de le transmettre est bien plus bas aussi.
Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question, I think, is for both the Premier and Dr. Russell. Starting in November, the United States will require all visitors who enter the country by air to be fully vaccinated to American standards. And currently, I believe the United States doesn't recognize a person who's received a mixed dose of Pfizer and Moderna as being fully vaccinated. But problematically, many New Brunswickers were told to take the first doses offered to them and are now double vaccinated with Pfizer and Moderna. Some people resent this and feel they did the right thing at the right time and are now being punished for it, especially those who have to travel for essential reasons. Are you considering making a third dose available to those New Brunswickers at their own risk, similar to what they have done in Quebec?
Well, at this time, we don't have plans to do that, but it's certainly something that we can take under advisement. We are aware that in Quebec, they have done that. They've proceeded with third doses for travel purposes, with the understanding that informed consent is necessary.
Thank you, Ms. Hogarth. Nathan DeLong, Miramichi Leader.
Can you hear me okay?
Yes, Mr. DeLong.
Sounds good. My question is for the Premier. Mr. Premier, I'm hearing concerns about a lack of representation in the two Miramichi area ridings that currently do not have MLAs, Miramichi Bay Niguac and Southwest Miramichi Bay de Vin. Those were vacated by two former MLAs who ran in the federal election, as you're well aware. I understand, though, that like you've mentioned with the concerns about rising COVID case counts, that may also pose issues. I'm wondering how the current situation is affecting your timing with the by-elections and if the growing case count will impact the looming by-elections in those ridings.
Well, I think the facts, it's real. It is impacting the decision on timing. And I do recognize that these are two ridings adjacent to each other that would makes a wide area that's unrepresented at this stage. So we'll need to address that one way or the other, but I think a by-election at this time with the COVID situation would not be the prudent thing to do. So we'll be pushing it out. I don't have a date to put out in front of you, but we know the timelines is required by law. But we will be pushing it out for certainly the foreseeable future certainly until we get this situation under control.
Thank you.
Thank you.
Tom Bateman, Brunswick News.
Hi there. Mr. Premier, it looks like all three opposition leaders will rejoin the all-party COVID cabinet committee. But Mr. Melanson, despite his involvement, said that the committee is, quote, patently a political foil for the Premier. So can you tell me what exactly changes about New Brunswick's COVID-19 response now that the committee is back in place? Thank you.
Well, certainly the advantages of having my colleagues and I work together with listening to public health, with listening to the debate from experts in the field, brought clarity to all of us so we could make decisions that were best interest of the province. I saw that all through our initial stages of the pandemic. And, there was some criticism that, that changed a bit in the last spring, but I think it was more in tune that we were coming out of this, or at least we thought we were, and that things were kind of winding down. Well, unfortunately, they've wound up again. So I commend my colleagues for rejoining because certainly, there were some issues that were raised about, having more information directly from, let's say, the epidemiologists and their projections on where we're going and what the peaks and valleys look like. More transparency in terms of what we could tell the public. And I think that primarily has come from the concerns around privacy. But if other jurisdictions are releasing information, then we certainly should be prepared to release the same types of information. So that shouldn't be an issue. What I witnessed today was certainly an engagement that was reminiscent of our last spring, early last year when we were working as one for the best interest of this province. I saw that this morning, and I'm encouraged by it because at the end of the day, we all may wear different political colors, but we understand the urgency of the situation and we pull together.
Thank you. Thank you, Mr. Bateman. Thank you, Premier. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, you say these measures are necessary to protect the healthcare system, but can you please tell us what exactly is the breaking point? Is it when all the ICU beds are full, and if so, how far off are we from that point?
Well, there's definitely points along the continuum that cause, secondary effects on the healthcare system. So once the ICU beds are full, obviously there's a change in what happens on the wards, what services can be offered. So it's a matter of what can be offered consistently around the province and at the point where you can't manage by switching people and resources from hospital to hospital, decreasing the ability to provide surgical services, et cetera. So we're definitely at the point now where the RHAs have worked together. They've pulled out all the stops in terms of what they can do, and being able to maintain the same level of services that we had before this surge, not possible. So we're definitely at that point, and that's why we're putting the measures in place now.
Thank you. David Caron, l'Acadie Nouvelle.
Oui, bonjour. Ma question est, je me demande combien pour la vaccination obligatoire qui a été annoncée, je me demande combien de personnes sont concernées au sein de la fonction publique, là, je crois.
I think at this point, it's safe to say there's likely within the 10% range of public service employees, and you could use that as an average across all the public sector, and that it would be in that vicinity.
Merci. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour le Premier ministre. Je me demandais comment vous allez faire appliquer ce lockdown-là, cette mesure coupe-circuit, parce qu'on peut penser que beaucoup des personnes qui ne sont pas vaccinées actuellement seraient aussi probablement les mêmes personnes qui ne respecteraient pas les consignes du confinement. Donc, j'aimerais savoir, est-ce que vous allez, comment est-ce que vous allez faire respecter ça? Est-ce que vous allez, je ne sais pas, donner plus d'amendes, ou est-ce que la police va être davantage présente, par exemple?
Our public safety officers will continue their surveillance, but focus it in areas of concern. And certainly the areas that we've applied the circuit breaker would be areas of concern. And there will be fines levied to enforce what we have put in place. I think that it's been the same way through the entire pandemic, that we will never catch everyone. And if people are going to just flagrantly violate the rules, they're having a negative impact on the entire society. And if you don't care about yourself, then please care about others. And that's the message. But we will be doing our surveillance runs, particularly on where the hotspots are, and particularly on events that have caused the problem. And these aren't events that are well organized. Everyone's vaccinated. These are events that are random. House gatherings have been a major source of spread, with multiple events or multiple visitations in a house at a given time, and that's why the impact on this weekend. We can't get into a situation where we kind of lose it on a holiday weekend.
Thank you. Mia Urquhart, CBC.
My question is for Dr. Russell. Outside of those hot zones you mentioned and the limit to single households, would you discourage people from gathering for Thanksgiving?
Well, again, we're trying to discourage the informal household gatherings, et cetera, that involve people that aren't vaccinated. Obviously, if you're traveling somewhere where you're going to be with vaccinated people and you're at an event or a venue where they're checking for vaccination, that's entirely safe in terms of what kinds of risks we're trying to address.
Adam Heuris, Brunswick News.
Thank you, Bruce. I spoke with two former New Brunswick Chief Medical Officers of Health yesterday who raised some concerns with the pandemic response. One of the major concerns raised was the question of political interference getting in the way of making the necessary public health decisions New Brunswick needs quickly. I was hoping you could both respond separately. Dr. Russell, do you feel you're always being listened to by Cabinet? And Premier Higgs, can you address concerns of political interference?
Well, in terms of people having their opinions, people are definitely entitled to have their opinions. There's no question. With respect to my participation in the COVID-19 cabinet and with cabinet, I have always felt that anything that public health had to say was very well received and always had a very fulsome, detailed discussion with all the members of COVID cabinet and cabinet.
And I would respond to that as well. You know, we found through just about any issue, there are a lot of experts that are in the field. We have an expert, we have a chief medical officer who has guided us through this entire pandemic. And while we all take criticism, you know, at any point in time, and this decision could have been different and that could have been different, you know, I liken to the, we've had success thus far working together as a team, and we'll continue to work together as a team. And I would challenge the concept that decisions are made outside of the best interests of this province and the people, because we've been following public health recommendations. We've been working with public health recommendations on health that goes beyond just what's the medical situation. It's in the mental situation. It's in the economy of the province. It's in the, and I've been pleased that the team has looked at the whole process and said, what can we do to mitigate the social damage, the mental damage, the economic damage, and the health damage? So it's not any one particular issue, but obviously health is first and foremost. And I'm very proud of the team that has been working with us as a government, but with our entire political group in terms of all parties to direct our province back to safety.
Thank you both. Alan Cochrane, Times and Transcript.
Yes, good afternoon. A question for Dr. Russell. You mentioned earlier about nursing homes and a new system of booster shots for people in the nursing homes. And also, you mentioned mandatory vaccinations for employees of long-term care. Is this something that's really new, or has it already been going on? And are there other restrictions or measures to help protect the residents of nursing homes?
So I'll start with the booster issue. That has been in discussion for quite a while at the national level and at the provincial level, partly because we know that in those vulnerable populations, they were vaccinated early compared to the rest of the population, and therefore the risk of the immunity waning is first and foremost in our priority in prioritizing that population. We did get recommendations from the National Advisory Committee on Immunizations to do that. So we are operationalizing that plan in long-term care and adult residential facilities this month. And with respect to the mandatory vaccination, I might let the Premier address that one.
I don't think I was ready for that.
Oh.
In relation to us putting the new mandatory order in place?
Mandatory
vaccinations in place?
Yes.
And the question, repeat the question, please.
Alan, Mr. Cochrane, could you please repeat the question for the Premier?
When does this start? I guess this is something that you just mentioned it earlier, that you would begin mandatory vaccinations for long-term care employees.
Yeah, well, it starts this Friday, and the timeline is 6 weeks in order to be fully vaccinated. So that'll give individuals time to get their first and second shots. And so we'll be monitoring that uptake very closely. And the intent is, and I said it's about 10% of the group across the network, but we've had some significant issues that have stalled vaccinations, so we have to ramp that up again, and this is seen as a measure to do just that.
Thank you. Sarah Derry, Radio-Canada.
Oui, merci. Ma question est pour la médecin hygiéniste en chef, Dr. Russell. Qu'est-ce que vous répondez aux critiques des anciens, justement, médecins hygiénistes en chef qui estiment qu'il y a une ingérence politique, que la distance entre la science et le politique ne se fait plus à la santé publique en ce moment?
Je voulais répondre la même en français que j'ai répondu en anglais, que les gens sont capables d'avoir des opinions. Il y a bien plus de monde, il y a bien de monde qui ont des opinions. Il n'y a pas de problème avec des opinions. Au sujet de la façon que on a travaillé depuis tout au long du pandémie avec le cabinet COVID-19, la façon qu'on travaille avec les présentations, des recommandations et les discussions avec toutes les recommandations, c'est vraiment un processus que je crois nous a servi jusqu'à moment et le fait qu'on a travaillé ensemble dans cette façon comme équipe, j'ai pas d'inquiétude.
Merci. Andrew Watt, Brunswick News. Andrew Watt.
Sorry about that. Can you hear me now?
Yes, sir.
Okay, thank you. Can someone clear up the Thanksgiving weekend rules, please? Because Premier Higgs kind of made it sound like it was one household gatherings, but then Dr. Russell kind of made it sound like that rule only applied to the circuit breaker zone. So I just want to get this right, please.
Yeah, I think the nuance here is that in the circuit breaker regions, we're putting that rule in place for 2 weeks minimum. And that is, and in the outside regions, outside of the circuit breaker regions, we're saying for this weekend only, for this Thanksgiving weekend, we need to have that same rule in place. And we're talking about it's in place between Friday at 6 o'clock until the following Monday at midnight. So it's one case that applies for 2 weeks to kind of get a handle on those hot zones, and the other it applies to the weekend in the other areas, this Thanksgiving weekend, so that we do not take a risk at this point in time to lose further control, and that we ensure that we are able to kind of regroup but not take a chance on losing it through unexpected gatherings in zones that are currently okay.
Thank you. Tim Roselle, Global TV.
Thank you, Bruce. My question is for either Dr. Russell or Premier Higgs, whoever wants to handle it. I was just wondering if there was any consideration given to closing schools for the under 12 population in those circuit breaker zones, and why or why not?
So we can both probably talk to that. So I'll say in the case of school kids, it's kind of a catch-22, but what's been learned is that the kids' safest place is in school and controlled, and in the sense of where as I've outlined here about the testing and the requirements, if there is contact or if there is a child that has symptoms, we have the rapid test kits which we're going to employ. So what happens and what we learned during the other phases of the pandemic are when kids are sent home, then it becomes a case as certainly if they can go home because they're sick, but if they're home, then they can prevent parents from working. They can prevent issues with if they're being contact traced without the rapid testing. Then they have cases of where do they stay? What is the case in the daycares? So it's been determined that through the process of testing, we can keep the schools open. We can test for those that need it, and we can get you back if you've continued to test negative. And kids have not been a source of being sick for we don't have any kids in hospital. I think we've had one throughout this entire pandemic, and it's been 24 hours for observation. No one in 19 has been hospitalized, and so even those that don't have vaccines or 12 and under who can't get vaccines, they are not sick. They can be transmitters, but they're not sick. So where's the best place to have them? And at this point, kind of the belief is that as we've learned, it's best to keep them in school where possible.
Thank you. Allison Sampson, CTV.
Good afternoon. My question's for the Premier. I'm wondering about how your COVID committee that you've reformed will be different this time than it was with its earlier iteration.
Well, I think the areas of concern that were quite readily identified, or I say remedied, was in relation to having some of the as I said, the epidemiologists, some of the folks that are right on the front line, being there to speak to their particular issue. So whether that'll be maybe the CEOs going forward, but in the case of folks in the lab, folks that are working directly with public health, and that are doing the projections. So that's what we certainly did this morning. There was concern, that we have a chance to openly debate the items and understand clearly what the recommendations are, and so that it is part of a general discussion. There wasn't any confusion that it goes to Cabinet, and Cabinet need to make the final decision as we are government. But it's not unfair at all to say that, if my colleagues are going to join, that they want to play a meaningful role, and they want to ask meaningful questions, and they want to have meaningful input, and they want to be heard and listened to. That's not an unfair request, and quite frankly, I am bothered by the fact if at any point in time they felt otherwise. So that was stressed, that we would ensure that happened. And I guess I just got to say that we saw that all through the pandemic, and there seemed to be some belief that it kind of changed back early or late last spring when maybe things were lightening up and we thought we were moving away from the pandemic. But today's meeting, I'm very appreciative of the input that I saw from all three leaders.
Shelley Steeves, Global TV.
Thanks, Bruce. My question is for the Premier. Custodians that are currently working in the schools diligently trying to clean and disinfect, say they're in a crisis situation. They say they can't keep up with demand for COVID cleaning requirements without the support of COVID cleaners, which of course were not brought back for this school year. Given the sheer number of cases that we're seeing in schools currently, can you explain why those COVID cleaners weren't brought back, and if there are plans now to reverse that decision and bring some additional support for the custodians?
Well, certainly we'll rely on the folks that are running the schools and looking at this. I understand, and Dr. Russell may want to add to this in relation to the new disinfectants that are used, and also the contact or the concerns that are raised in terms of transmission and how it's picked up. It would appear that it's picked up person to person for the most part. And while we certainly have to be diligent about cleaning and we will provide the right level of cleaning materials and personnel, and I would suggest that would come from the Department of Education if they need more individuals as before, because there certainly hasn't been any limitations placed from any other perspective than doing what's necessary in the school.
Thank you, Premier. Thank you, Ms. Steeves. Thank you to members of the media and everyone for joining us for today's update. This concludes the update. Merci aux membres des médias, tout le monde. Voilà la fin de notre mise à jour. Merci beaucoup.